Hi, Dr. Dhruv.
Hi,
Hi, Dr.
hi,
Dhruv. How are
hi.
you?
Am I audible? I'm fine.
Yeah, you're audible.
Thank
Thank
you.
you so much for joining me on this extremely important session. And the time could not be more, time couldn't be more, I don't know what to say. It's a very pressing time right
Exactly,
now, I think,
exactly. Rather, I should be thanking
it's a very,
you for giving me this platform because, not all actors or celebrities tend to do so because most of them tend to, spread messages on their own which might be either false or, might mislead. But thank you for giving me this platform to share with you my views on this issue. So I really
no,
appreciate that.
absolutely. No, you're most welcome, and it's really my honor to talk about this extremely compelling topic because now
Exactly.
we can't push it under the rug
No, no,
anymore.
no.
This
Definitely.
mental health, I feel in India, the shame that is attached to the mental health idea that, everyone's so ashamed of talking about it. And I have noticed in the last, few days also after Sushant Singh's death, I've noticed why that happens. Because even the ones who are trying to help, there's all sorts of trolls that are happening कि अरे वो तो attention seeking है, अरे वो तो देख ड्रामा
True,
कर रहा
true.
है, ड्रामा करती है, अरे उसको तो खाली ऐसा प्रिटेंड करना है, कोई डिप्रेस होता है तो सच में ऐसे थोड़ी लिखता है, वो तो डिप्रेस होएगा ना, वो बात थोड़ी करेगा. Like
Exactly.
I have posted about I've posted about helplines where people can call, and
Yes, yes.
some really some really vicious people, even after that they are writing things like कि अरे कोई डिप्रेस्ड होगा तो मरेगा कि फिर कॉल करेगा. I mean,
Exactly,
the
exactly.
mindset is so
Uh, the mindset,
the
the
mindset is so
stigma
pathetic.
associated along with any kind of mental illness, not only depression, anxiety, but
Yeah,
uh, the general mindset of the people in India specifically is that कि हाँ कि अगर कुछ है तो ये तो पागल है कि या तो ये attention seek कर रहा है.
हाँ,
That is very commonly seen in India. So people don't tend to approach a
correct.
psychiatrist because ये तो पागलों के डॉक्टर है and all. So they don't see the whole
Hmm.
word, the whole term of pagal is very derogatory in India. So it's like, हाँ ये तो पागल है.
Yeah,
ये मतलब the
yes.
anything if you visit a psychiatrist, what they tend to think is कि हाँ ये तो पागल है इसीलिए पागलों के डॉक्टर के पास जा रहा है. The whole stigma is really bad associated with the field right now. So you rightly said that
Correct.
uh,
Absolutely.
people who tend to post about their feelings are classified as being like attention seeking, or they want to see like इसको तो हाँ बस भाव
Yeah,
चाहिए इसीलिए या फिर sympathy चाहिए इसीलिए कर रहे हैं.
correct.
So the whole purpose is
Sympathy
missed.
चाहिए.
Yeah,
Correct.
the
That's
whole
what.
purpose is missed over there. Yeah.
So so what happens is the person who's suffering caves in even more, और
Exactly,
घबरा के वो
exactly,
और अपनी बात नहीं कह पाते.
exactly. Very true.
क्योंकि दोनों ही तरफ से डॉक्टर के पास जा रहे हैं तो पागल बोल रहे हैं, दोस्त लोगों से बोल रहे हैं अरे वो अटेंशन सीकिंग, क्या सिंपैथी, क्या सेल्फ पिटी, इट्स अ प्रीटी
Exactly.
बैड विशियस सर्कल. First of all, Dhruv, another point that I wanted to bring up here is India में मैंने notice किया है, why is there so much aversion, इतना ज्यादा मेडिकेशन को लेके लोग क्यों घबराते हैं? एंड आप प्लीज साइकियाट्री में मेडिकेशन कितना इंपॉर्टेंट है इस बारे में बात करिए.
Definitely, definitely. So the first thing is कि इंडिया में the scene is कि I'm not blaming Bollywood completely, but movies में ऐसा दिखाते हैं कि psychiatrist के पास गए तो वो शॉक देते हैं, या वो बहुत मूवीज में ऐसा दिखाते हैं कि बांध के लेके गए और शॉक दे दिया, और या फिर दवाई दे दी जिससे नींद आ गया. सो ये जो मेंटालिटी पहले से डेवलप हुई है, जो अवेयरनेस बहुत लैक कर रहा है इस चीजों पे. तो ओवरऑल मेंटालिटी ऐसी हो गई कि हाँ कि अगर कोई पागल है तो इनके पास जाता है साइकियाट्रिस्ट के पास और दवाई देते हैं और सुला देते हैं. सो ये बहुत गलत एक माइंडसेट हो
हाँ,
चुका
हाँ,
है पीपल का कि साइकियाट्रिक मेडिकेशन सिर्फ सुलाने के लिए है या नींद की गोलियां देते हैं या सिर्फ शॉक देते हैं. सो द थिंग इज कि मेडिसिन आर इक्वली इम्पोर्टेंट. मेंटल डिसऑर्डर भी जैसे डायबिटीज है, जैसे डायबिटीज में आपको एंटी डायबिटिक्स ड्रग्स देने पड़ते हैं, इंसुलिन देना पड़ता है. जैसे हाइपरटेंशन है जिसमें आपको एंटी हाइपरटेंसिव देने पड़ते हैं. तो इक्वली ये भी एक डिसऑर्डर है जिसमें आपको दवाइयां देनी पड़ती है. तो बेसिक हर एक साइकियाट्रिक
correct.
इलनेस है, जैसे स्किज़ोफ्रेनिया है, जैसे डिप्रेशन है, एंजाइटी है. तो स्किज़ोफ्रेनिया में क्या होता है कि हमारे ब्रेन में एक केमिकल होता है जिसको हम साइंटिफिकली न्यूरोट्रांसमीटर्स कहते हैं. तो ये न्यूरोट्रांसमीटर्स के लेवल का इसका स्किज़ोफ्रेनिया मतलब जिसमें डिल्यूजन्स होते हैं, हेलुसिनेशंस होते हैं, उसमें क्या होता है कि डोपामिन का लेवल
राइट.
बढ़ जाता है. तो हम ये दवाइयां देते हैं कि डोपामिन का लेवल कम
ओ,
करे, जिसकी वजह से वो एक ऑप्टिमम लेवल पे रह के वो नॉर्मली फंक्शन कर सके। सिमिलरली डिप्रेशन में क्या होता है कि ब्रेन में एक न्यूरोट्रांसमीटर होता है जिसका नाम होता है सेरोटोनिन। तो सेरोटोनिन के लेवल की कम होने की
राइट।
वजह से तो ये डिप्रेशन होता है, एंजाइटी होते हैं, और दूसरा उसका पूरा स्पेक्ट्रम जो होता है। तो मेडिसिन का काम ये है कि ये सेरोटोनिन का लेवल बढ़ाता है, एंटी डिप्रेशन का। और एंटी साइकोटिक्स मतलब जो स्किजोफ्रेनिया में यूज होते हैं उसका काम ये है कि वो लेवल्स को डोपामिन के लेवल्स को कम करता है। तो जैसे डायबिटीज में शुगर लेवल्स को जैसे कम ज्यादा करते हैं, जैसे साइकेट्रिक मेडिकेशन में भी न्यूरोट्रांसमीटर्स के लेवल कम और ज्यादा करता है मेडिसिन। तो द मेन पर्पस ऑफ मेडिसिन जी का ये नहीं है कि सुलाना है, कि सो जाते हैं, कि सिडेटिव है, कि
हाँ।
सो जाते हैं, कि नींद की गोली है, तो वो उसका पर्पस नहीं है। हाँ, कुछ कुछ केसेस में हमको नींद के इंजेक्शन, नींद की गोलियां देनी पड़ती है जब पेशेंट बहुत ज्यादा एग्रेसिव होता है, जब कंट्रोल नहीं कर पाते, जब उनको
राइट।
दूसरों को हार्म कर रहे हैं या खुद को हार्म कर रहे हैं। तो ऐसे केसेस में हमको उनको यू नो in such cases we need to give them sedatives which are required to sedate the patient or make the patient sleep. But in patients who are not aggressive, who are not harming themselves or harming others, we give them normal routine medications which help adjust the levels of neurotransmitters in the blood and body, which eventually help in treating the illness. So psychiatric illness is as equal as any other physical illness that you can suffer, which requires medicines for treatment. So the whole myth और जो myth है पूरा, जो psychiatric के जो medicines के against है, वो change करना जरूरी है। तो जैसे कोई भी डिसीज या डिसऑर्डर के लिए मेडिसिन होते हैं, वैसे ये भी एक डिजीज है। हाँ, इसमें आप देख नहीं सकते, आप ब्लड टेस्ट, देयर आर नो ब्लड टेस्ट टू कंफर्म साइकियाट्रिक इलनेसेस, देयर आर नो you cannot find out that there is something wrong in a CT, in an MRI. So that is what makes a difference here.
Yes.
So कुछ देख नहीं सकते, so लोग don't they start avoiding medicines. So that is why medicines are very important in psychiatric, because like any other illness, this is also a disorder which requires treatment.
So again, this is like any other imbalance in body.
Exactly.
Like diabetes, it's insulin that is out of balance. In this, it could be serotonin, dopamine, or so on.
Yes.
I think I believe even in anxiety disorders, they use serotonin, right,
Yes,
to
serotonin is the
stabilize
main,
the
yes,
patient
yes,
over a period. And now the other thing is, लोगों को also ये भी लगता है कि यार जल्दी होना चाहिए ठीक, अभी एक दो बार गोली खा ली अभी ठीक हो जाएंगे, you know,
True,
और
true.
नहीं हुआ तो गोली या फिर खाना छोड़
One
दिया,
time
you know,
mistake.
like they expect some kind of magic. So from a professional medical perspective, what is the real timeline, you know, कितने टाइम में एक शख्स को अपने अंदर एक डिफरेंस दिखेगा और इम्प्रूवमेंट की वो मतलब एक्सपेक्टेशन रख सकते हैं दवाई लेने के बाद, रेगुलर दवाई लेने के बाद?
So ideally, any medication takes about 2 to 3 weeks to show their effect. Okay. So जैसे फीवर जैसा कुछ नहीं होता, जैसे फीवर में कैसे 5 दिन दवाई लेनी, तुम्हारा फीवर ठीक हो गया, खांसी हुई, you take medicine for 3 days, 4 days, you're fine. So this is different. जैसे as I told you, the basic biology matter behind this is that the neurotransmitter levels are in imbalance. So to get this neurotransmitter level in a proper balance, in a proper amount, it takes time. Because medicines are taken orally, they go into the body, they go into the stomach, they go into the gastrointestinal tract.
Right.
Udhar se it goes into the blood, it crosses the blood-brain barrier and then goes to the brain. So it takes time for this. So each drug requires a steady dose in the brain to get its effect. So ideally, like what the most common example that we give to patients is कि अगर आपको फ्रैक्चर हुआ, ठीक है, तो डॉक्टर आपको बोलते हैं कि आप 1 महीने के लिए प्लास्टर रखो, 1 महीने के लिए कांच रखो, ठीक है। तो अगर आपने 15 दिन में वो कांच निकाल दिया, तो आपको बाहर से तो दिख रहा है कि हड्डी जुड़ गई है, बट अंदर से जुड़ी नहीं है। सो दैट इज व्हाट वी ट्राई टू कोलैबोरेट विद, इज लाइक कि जैसे उसके लिए 1 महीने का ट्रीटमेंट कांच करना जरूरी है, वैसे द मिनिमम ड्यूरेशन फॉर एनी साइकियाट्रिक इलनेस कैन रेंज डिपेंडिंग ऑन द इलनेस एंड द ड्यूरेशन, कब से चालू है। इट कैन रेंज फ्रॉम आइदर 3 months to 6 months to a year. If इलनेस इज क्रॉनिक, लाइक बहुत सालों से अगर दवाइयाँ बहुत सालों से ये इलनेस है, 4 साल 5 साल, तो लाइफ टाइम मेडिकेशन कंटिन्यू करना जरूरी है। लाइक सर्टेन डिसऑर्डर्स लाइक बाइपोलर मूड डिसऑर्डर, जिसमें देयर आर फेजेस ऑफ हाइपोमेनिया एंड डिप्रेशन। सो देयर आर अ फ्यू मंथ्स इन विच देयर इज मेनिया, जिसमें बहुत बड़ी बड़ी बातें करते हैं, दे आर एक्सट्रीमली हैप्पी, एंड देयर आर अ फ्यू मंथ्स विच आर फेजेस ऑफ डिप्रेशन, इसमें बहुत डिप्रेस बातें करते हैं, सैड रहते हैं। तो उसमें दवाई लेने
you are able to reduce the number of cycles that come, and the duration of the cycles also reduces. So medicines का long term लेना जरूरी है.
I see.
Yeah.
Okay.
So minimum
And
duration.
another question that I had from you is, yeah, minimum duration. You were saying minimum duration.
Minimum duration for at least anxiety disorders can range from 3 to 6 months. If it is if it has been occurring since a short duration, if the illness has been occurring for a very long time, you might have to take lifetime medications. But it is the same as in case of diabetes or hypertension. So it is not going to harm you.
Correct. Correct. Yeah, that brings me to my next question. I think a lot of people also, अभी काउंसलिंग के लिए काफी फिर भी लोग काउंसलर्स के बारे में बात करने में इतना नहीं शर्माते. पिछले 2-3 साल से मैंने ट्रेंड देखा है. But can counseling alone fix a mental disorder is my question. Like, because everybody seems to be okay with counseling. बात medication की होती है तो नहीं. Counseling is fine, but can it really even cure the problem?
So that is what. So the whole thing is based on stigma. कि लोगों को लगता है कि साइकियाट्रिस्ट के पास गए तो मेरा ऐसा है कि मैं पागल हूँ इसीलिए मैं साइकियाट्रिस्ट के पास जा रहा हूँ. So that is the whole problem regarding this illness. So agar counseling is important, there is no doubt that counseling plays a very important role in treatment of depression, anxiety, and those spectrum. In cases of schizophrenia, it might not play that major of a role, but counseling, it is not necessary that, but only counseling is not going to help in any illness. So the mainstay, the main treatment is medications. So unless and until medications work, you're not going to help.
Okay, can you please repeat that, sir? Can you repeat that, sir? You just said the main treatment is medication. Yes. I think you should please say that again to the people listening.
Medicines are the mainline treatment. Counseling acts as an adjuvant to medicine, which helps in recovery, helps in better recovery of the patient. Correct. So, but the point is, because of the stigma associated with visiting a psychiatrist, people tend to avoid going to them and prefer going to a psychologist or a counselor saying that कि हमको कुछ stress है तो उसके बारे में बात करने जाते हैं. So that is not looked down upon as of now, because of the some amount of awareness that has been spread already. वो कम हो गया है कि वो स्टिग्मा कम हो गया कि साइकोलॉजिस्ट के पास आप जा सकते हो, बट अगर साइकियाट्रिस्ट के पास गए तो आप पागल हो तो ही आप जाते हो. So once again to repeat, medicines are the mainstay treatment. Counseling acts as an adjuvant and helps in treatment, helps in better treatment of the patient.
So now you guys have heard it straight from the doctor. Just जब मैं ये बातें बोल रही थी, मुझे कई सारे trolls आ रहे थे. But it's sad that in India, medication के नाम पे इतना क्यों घबरा रहे हैं हम? Aren't people on BP taking medication? Aren't people on diabetes taking insulin injections? तो अभी इसमें इतना बड़ा क्या बात हो गई है कि Another thing, there's a lot of misinformation about the side effects of medication when it comes to psychotic medications or anxiety medications. People think कि अरे नहीं उसमें ना memory lose होने लग जाएगी और उसमें हम brain dead हो जाएंगे, उसमें हमें नींद आती जाएगी. तो what are the actual side effects? Tell us all and tell us about why these kind of rumors float, कि उसमें brain dead हो जाएंगे और memory loss हो जाएगी और vegetable बन जाएंगे और ये वो.
So again, you can blame the media for this when they show कि हाँ patient को दवाई दे दी तो patient robot बन गया, patient zombie बन गया, numb हो गया emotionally, feel नहीं कर पाता है. Also a lot of myths कि हाँ ये तो नींद की दवाई है, ये memory loss हो जाता है, कि इससे मेरा वजन बढ़ जाएगा या फिर मुझे कुछ feel नहीं कर सकता मैं मेरे. So all these are myths because there is lack of awareness of the medication. Because if you don't consult, ये लोगों ने ये misconceptions अपने mind में already fix कर दिए हैं कि जो relatives को भी भड़काते हैं कि like in my OPD I see a lot of patients who come to me and they say कि नहीं मुझे मेरे relative ने बोला कि नहीं ये खाना नहीं चाहिए, ये तो आदत डाल लेते हैं, ये addictive medicines होती है. Like these medicines are very addictive, they put you a habit of. So all these are misconceptions. See, there is no medicine in the world that does not have a side effect. Okay, I'm not denying that the medicines don't have side effect. Like you have minor side effects, like some people are not able to. We have gastrointestinal side effects. You have some in which you have dryness of mouth. In some in which you can cause a bit of dizziness. some also cause hypotension. But
Yeah.
these are experienced not by each and every person who take these medications. Okay, so for example, अगर आप road cross करने वाले हो तो आपका accident हो सकता है. Okay, so that does not mean that you stop crossing the road.
Correct.
Exactly. So the incidence of a accident is suppose 1 in 100. Similarly, not all patients who take medications develop side effects. If at all they do develop side effects, we have better other alternatives that can help in reducing the side effects, or medicines that do not cause side effects, because side effects are something that you cannot predict. And like a lot of people might say that weight gain is a very important side effect, but let me tell you one thing. See, medicines will not help. वो वजन नहीं बढ़ाएगा medicines आपका. See, weight gain is because of food. Okay, so if you for eating, it is going to increase your weight. See, medicines can increase your appetite.
Yeah.
See, that is true that medicines increase your appetite, but it is up to you to control that appetite. What we suggest is, rather than binging or eating, we suggest you eat something healthier that will also satisfy your appetite, cravings, and help you not gain weight also. So there is a solution for each and every problem, but the thing is, you should discuss this with your doctor. You don't just assume or listen. You should not listen to people who are not aware about this and are telling you that these medicines are bad blindly. No, by not even, they don't know what medicines contain.
Correct.
They just have heard it from somewhere and are telling you that no, this is bad, these medicines are bad. Yeah.
Also, I think a lot of people, I mean, the stigma, especially against allopathic, is so strong. They will start doing the same thing in jadi butiya.
Exactly.
You know, the Ayurved mein wahi karne lag jayenge. But my thing is, what is your take on alternatives? You know, like or do you think that no? I mean, you know, these are chemically formulated things which work most effectively. So, iske jagah Brahmi kha lena ya iski jagah tulsi le lena and all ya ashwagandha kha lena. Matlab, what is your take on this? Or what are the alternates also, if you can tell us, in addition to medication, traditional medication?
See, I don't have anything against homeopathy or Ayurved in that way. But to be frank, I don't have knowledge about these fields. So I can advise about my field. I advise that, okay, allopathy medicines are not bad. Like it is not 100% proven that Ayurvedic and homeopathy medicines also don't have any side effects. Okay. But I'm not an expert to comment against them. But the thing is, so they are also not without any side effects. I don't know what role they play. Like, I have not seen any patient who has gotten better with taking only Ayurvedic or homeopathic medicines. Like in my career, I have not seen any patient getting better with homeopathy or Ayurvedic. To mention a case that we had seen before, like a few months back, we had a patient who was taking Ayurvedic medicines. He had seizures, akdi, jisko bolte hai. Okay, so what happened is, he used to take powder from Baba saying that ये Ayurvedic powder है, इससे akdi ठीक होता है. So one patient who was smart enough to get the powder tested, it turned out that it was an anti-epileptic medicine known as phenytoin. So it was an allopathic medication given under the cover of Ayurveda.
Oh.
This is just an example. I'm not saying Ayurveda and homeopathy are bad.
Like placebo.
Exactly.
I get it.
So I'm not saying that both are bad, but I don't have experience enough in them to comment on them. Alternatively, see, medicines are the mainstay treatment. Alternatively, what you can try is have a healthy lifestyle, have healthy food habits. Sleep is one of the most ignored fact in all the populations. Like, people don't realize the importance of sleep. To get an adequate amount of 6 to 8 hours of sleep is very important, because sleep deprivation precipitates a lot of psychiatric illnesses like stress, anxiety, depression. So even something as simple as having a proper sleep cycle, having a regular sleep cycle, having 6 to 8 hours of sleep daily is also important to prevent psychiatric illnesses. So, like, as an alternative, I suggest a lot of healthy lifestyle choices. Also, meditation can help in some cases. So people who think that you cannot do all this, they can also try all these other adjuvant therapies. See, but medicine is the main treatment. This is just an adjuvant so that you can increase the effectiveness of the medicines.
Right.
Yeah.
So it's like how we have to eat healthy, and if we work out, then that can enhance.
Exactly.
But eating healthy is not negotiable.
Out
We have to
releases
eat right.
endorphins, which is really helpful.
So it's something like correct. So another question that it brings me to is that what are the steps, that ensure speedy recovery? Just taking medicine alone can't be the thing. So what are the other steps that one needs to incorporate for a speedy recovery?
So for a speedy recovery, you need to ensure that you're taking the medicines on time as prescribed by the doctor, and you ensure that there is no break in medicines that you take. So what happens is a lot of people feel better with medicines and they feel that ab main theek ho gaya, but they don't realize that this is happening because they are taking medicine. They it's like if you stop them, medicine is going to come, the level of the neurotransmitter is going to come down in the brain, and then immediately they're going to be even worse than what they were before, because the brain is deprived of the chemical.
Correct. So that is
so regular compliance.
I think I was just reading an article about this before. Regular compliance. I think this is also a tendency that जैसे मैं ठीक हो गया तो अभी बंद कर देते medicine. They do self-doctoring.
Exactly. That is very common in fields of psychiatry, because they don't realize the importance of taking medicines for a long time. They tend to get tired of taking medicines continuously for a long duration. So that is why we keep ensuring that they should be taking medications. Secondly, like I said, as an adjuvant to medicines, what we can do is we have a healthy lifestyle, eat healthy, you can exercise regularly, you can sleep adequately, you need to keep a routine, you need to keep a schedule, because it is very aptly said that an empty mind is a devil's workshop, and it is true in case of psychiatric disorders. Like in the current pandemic situation, we've had patients we have seen a surge in the number of psychiatric cases. We've seen a surge in the number of cases that have come in. So that is very important. Like a lot of people are working from home, are not working, whose work has stopped. They are tending to what we call scientifically is sensory deprivation, because they're locked in home all the time. They have nothing else to do. So they tend to be more prone to psychiatric illnesses. So you need to have a schedule, even if you're not working, even if you have a day off, you plan your day ahead. Don't waste your time doing anything at all. Yeah. So like I said, alternatives can be
I think that's great advice. Healthy living. I think that's a great advice. Another thing that I have generally noticed, when you read about a lot of these famous stars who have everything and yet they were so lonely and so depressed inside, So with the fancy life, a lot of people also, I believe that not the fancy life, but people who are generally depressive sometimes can also resort to recreational drugs as well. And what do you think? Does that conflict with your line of treatment if you're on medication? If you're, let's say, on the side also doing recreational drugs because that gives you an instant high or whatever, does that interfere with your treatment?
Definitely. So the thing is, first to see, there are people who think that ये तो actor है, इसका तो life इतना glamorous है, इतना अच्छा है, he has everything. इसको कैसे depression हो सकता है? इसके पास तो सब कुछ है. So the thing is, you never judge a book by its cover. The thing is, a person who appears very happy outside, you do not know what their personal life is, what they are facing every day. In spite of being in a crowd, in spite of being with friends, you can still feel lonely. So that is what we need to acknowledge first. So
very true.
So you need to have a healthy social life.
Very true.
It is not important to have a social life, but it is important to have a healthy social life in which your peers are encouraging you. To come to the point of recreational drug use,
correct.
Some
very
people
true.
have a social life in which there are friends who tend to use substances, and due to peer group influence, due to I want to try it, they tend to go into the path of drug abuse, recreational drug use, alcohol, cocaine, cigarette smoking. There are a lot of addictions that we can count on. So the thing is, these substances compete with the naturally occurring response, what we call these neurotransmitters act on what we call receptors. So these chemicals, these substances compete with the neurotransmitters to act on the receptors, so that the receptors, the neurotransmitters are not able to act on the receptors.
Oh.
So, like, the thing is,
okay.
if you take a substance, for example, alcohol or tobacco or cocaine or anything, they will reduce the effect of the medicines. If you're taking medicines, they will not let the medicines act. So if you take medicines as well as substances, the medicines are useless, basically. So also, the substance will give you a very temporary high, because most of the substances are highly addictive.
Correct.
Nicotine being the most commonly consumed substance and most addictive helps. It gives you a temporary high, but eventually it has the most amount of withdrawal. We have alcohol withdrawal, we have withdrawal due to all sorts of narcotic drugs, all sort of sedatives, hypnotics, all those kind of drugs. There is a withdrawal which worsens the levels of neurotransmitters in your body. So drug abuse is going to make it worse. There are a few studies which suggest that there are people who feel that marijuana is going to help them, like weed is very good for your body and all. They help to calm you down and all, but that is not true. The thing is, it gives you a temporary high, which eventually long term is bad for you. Marijuana is like in certain conditions like glaucoma. Marijuana is very helpful. It reduces the in glaucoma is a case in which there is increase in the intraocular pressure of the eyes. So in certain conditions it is helpful, but in psychiatric conditions, I strongly I don't advise use of recreational drug use, because it is going to give you a temporary solution. In the long term, it is going to harm your body. Alcohol harms your liver. It is written on the packet. Cigarettes causes cancer. It is written on the packet. Cigarette also causes impotency, which is also very rampant.
Correct.
What we joke around in our fraternity is that if people start putting that on cigarette packets, if they start putting that cigarette causes impotency, it is going to be more easier way of stopping cigarettes from being sold. But jokes apart, all kinds of substances are going to harm your body and eventually your brain. So I strongly advise to go against any of the substances that happen, any of the substances that are abused.
Right. Dr. Dhruv, I had some questions from the audience. They have requested anonymity, so I will not name them, but I would just like to share some questions that came to me. So there's this gentleman who wrote to me that he suffers from emetophobia for the last 5 years. And what this emetophobia does is that it comes in the way of him going to public places. He can't eat in public places always. And, he gets nauseous when he is on a public transport. And sometimes he has to wait all day long to reach home and then eats his dinner. So all day he'll be hungry because of that. It's a bit of a tongue twister. Emetophobia not, letting him be. So what do you think? How can this emetophobia be helped?
He or she should consult a psychiatrist, because all kinds of phobias are treatable. See, phobias come under the spectrum of anxiety disorders.
Okay.
So, what a phobia is basically, a person is afraid of a specific stressor or a specific situation. So, it can be treated successfully. We have medicines that like fluoxetine, we have medicines, anti-anxiety drugs, which will help him or her cope better whenever they go out in public, or help him or her better when they are in a situation where they are phobic about. Also, there is a therapy known as exposure and response prevention therapy, which helps the patients deal with phobias better. So it is definitely treatable. What I advise is he or she should consult a psychiatrist without being afraid that he or she will be judged for the phobia. Because psychiatrists, unlike what they portray, are very good people, are very kind people.
Yeah, see, we have one right now, guys. That's how friendly they are. So you don't have to think of them as someone who's going to put you on an electric shock chair, or, that's not who they are. They are very learned, very functional people. So this was about emetophobia. I hope that it helps him. 5 years he's been suffering, he's written. And what he's also written conversely is that it's increasing, and I think that happens in any kind of paranoia or any kind of phobia, that if you don't check it, then it can just trickle into everything.
It is going to come to a point where he'll not be able to function and he'll not be able to perform his daily routine activities also. So it is going to worsen if an intervention
Oh,
is done right
wow.
now.
No, I'm sure that your advice has really helped him. Another question that I got here is that there's this gentleman who's on the last stage of depression.
Yeah.
And he's written that what are the precautions that he can take so that he doesn't do anything untowardly, so that he doesn't take any extreme step.
So
because he suspects that he's on the last stage of depression.
First thing I tell him to, if at all he gets such thoughts, first thing, he should never be alone. He should always be with people who are there to stop him from doing anything untowardly. Secondly, he has to consult a doctor, or if he does not feel comfortable with a doctor, he should visit a psychologist so that he can share what he is going through. Depression, it is not classified in stages scientifically, but the thing is the last stage, this is putting it very laymanly, the last stage will be when the patient feels that he or she does not want to live or has suicidal ideations. So that is what we call as the last, what we can say as the last stage of depression. So though the antidepressant medications, which are most commonly what we call as SSRIs, or selective serotonin reuptake inhibitors, this is the scientific name of the drug, they help in reducing suicidal ideations. So if these medicines help in reducing the ideas of ending their lives. Alternatively, ECT or electroconvulsive therapy can also help with suicide. With patients who are having suicidal ideations, can receive ECTs, or what is laymanly known as.
What is it? What is ECT?
Yeah, ECT is electroconvulsive therapy. Yeah, electroconvulsive therapy. So unlike what they show in the movies कि patient को पकड़ के खींच के लाते हैं, 4 ward boy लेके आते हैं, बांधते हैं, मुंह में ऐसा कुछ तो भी रख के शॉक देते हैं. That is not what ECT is. That is what it is portrayed to be. So ECT is given under general anesthesia, in which the patient does not feel that he is going through a shock or he is going through some painful experience. The thing is, the whole body is given as जब operation करते हैं. Okay. So जब ऑपरेट करते हैं वैसे ही पेशेंट को पूरा जनरल बॉडी में एनेस्थीसिया देते हैं. The patient is not aware about what is happening. Of course, the consent is taken before this, and there is brain stimulation. It is not a current that goes through the body. It is a brain stimulation, and let me specify the stimulation is for a duration of 0.1 second. Okay, so it is for a duration of a very short duration of 0.1 second. So unlike what they show in the movies कि वो patient बेहोश होने तक उसको shock देते हैं, is not true. So it is given for a duration of 0.1 second, which induces a seizure in the patient, which helps in suppose अगर phone का battery low हो गया, तो we put a charger for it. Okay. So just like that, brain stimulation is given. It is not a shock. Okay. It is a brain stimulation which helps in resettling the levels of the neurotransmitters in the brain. So that is the
got it.
So for suicidal ideations, ECT is the indication of choice. Also, you can first thing is we start for medicines. First thing is we start them on medicines, and medicines is going to help them. ECT requires the very last measure because it requires a lot of procedure to be done. You need anesthesia fitness, you need to do blood tests, you need to get an ECG and X-ray done. When, unless and until the patient is fit to go ECT or anesthesia, only then an ECT is given. But antipsychotic medicines are, antidepressant medicines are very important in treating suicidal ideations. So he or she should consult a psychiatrist and start on medicines as soon as possible.
That's, I think those are some very good pointers. And if, to the person who sent me that question, first of all, I hope आप अभी सुन रहे हैं हमें. And look, now Dr. Dhruv has already said that you are completely, curable. So don't do anything.
Exactly.
And all you have to do is look into antidepressants and ECT. So don't do anything. It's curable. Correct. Now, the other question that has come to me quite interestingly actually is, which I also have noticed in my own friend circle and all, and it happened with me also once in life, that, people don't even confide in their partners if they have a problem, because they are scared that then they will be left. But that can't be the healthy approach. Like, your partner should know if you have, let's suppose you have bipolar, let's suppose you have, I don't know, nascent schizophrenia or OCD. I think it's, so how can partners come to a place where they can start being a little comfortable, yeah, about confiding in each other about these things without thinking कि अब मेरे को ये dump
Very,
कर
very,
देगी
very
या
true.
dump कर
Lot
देगा
of couples come to us in which one of the partner is not aware of the illness. They just get them to the doctor and they say कि हाँ मेरे
Yeah.
husband को मत बताना या मेरी wife को मत बताना, which I think is very wrong, because you are going to
Oh God,
spend all of your time
very wrong.
with the person. So, see, for the sake of confidentiality, we cannot disclose it to their partners. But it is them who should tell them to their partners when,
You okay?
कि this is what is happening with me, so that the partner can also be actively involved in better welfare. So
Also
the
be
thing is-
educated in that. Also be
Exactly.
educated in how to be
So,
around a patient.
So like you said, bipolar. So bipolar also has early signs. Okay. So when the patient is going to go into mania,
Okay.
there are certain things which have a few early signs. Okay. So there are some markers which indicate that no, now the patient is going to go into mania. So if the partner is aware of these signs, then he'll be able to guide the doctor and the patient and help the patient better. Because in most of the situations, a patient is not
Correct.
able to express about what is going to happen to them, because they are not in the right state of mind at that time. They're not able to convey to their partner or not able to tell the doctor. So if the partner is actively involved in the welfare of the partner, it is better. It is helpful for the patient itself. There is always the risk that people feel कि अगर मैंने बता दिया तो he'll leave me. Okay. So they feel that if they find out that there is something wrong with me, then they'll leave me. See, the thing is, if you hide it from them, it is going to make it worse. So if you hide it from them and one fine day they find out that this person had an illness and he hid it from me, that is going to make it worse. That is going to strain the relationship further. That is going to lead to a lot of mistrust. So what you think to do is you need to express what you feel to your partner. If the partner is right for you, he or she will definitely understand what is going on.
Absolutely. That's what I wanted to add, that if their love is so comfortable and convenient that just because you have a certain disorder and they are running for the hills, then do you really want to even be with a partner like that? Because for something or the other, they are definitely leaving you. May not be for this, it may be for something
Both
else.
of them
But
need to be
then that
understanding.
partner doesn't have depth of character. Yes,
True.
exactly. So this was my question on this partnership thing, and I have a couple of more questions, Dr. Dhruv. So the depression one we've spoken. I want to talk about Indian parenting, which again I find it very flawed. In India still till date, parents and the communication between parents and children is so formal.
True.
सब कहते हैं कि हाँ बात करो लेकिन इतना बड़ा एक फॉर्मेट है ना पेरेंट्स से बात करने का कि आप बहुत सारी चीजें बोल ही नहीं पाती हो. Your parents are sometimes the last people that will know anything that is going wrong with you, and they are blamed for it. So what do you have to say to Indian parents? That whole tiger parenting is there here, na? कि ऐसे नहीं बात करो, वैसे नहीं बात करो, and I think it's very regressive at a collective level.
So this is a very sensitive topic to talk about first thing, because firstly, Indian parents don't raise their children to talk about mental health issues. I was lucky enough, my parents are also psychiatrists, so I was lucky enough to be raised that way. But like majority, I'll tell you a scenario in which majority of the cases will go. Like for example, you take a kid who goes to his parents.
Right.
The first thing parent will हाँ तेरे को मेरे like अभी तेरे को बात करने को time मिल रहा है. See, the most of the time the thing is कि हाँ phone दुश्मन है, phone में रहता है पूरा दिन. You don't have time to talk to me. That is what the parents are going to complain about. Once the kid approaches to the parent, they will be like हाँ कि ये तो किसी की बुरी नजर लग गई है या किसी ने मेरे बेटे के साथ कुछ they'll be in complete denial कि there is nothing wrong that can be with my kid. Indian parents, though, may be portraying as villains, but they are in complete denial that their child can be wrong, that there can be some problem with their children. Eventually, the whole thing comes down to awareness and education. If the parents are not aware of a psychiatric illness, it is going to be very, very, very difficult to approach the parents. But the bad thing about Indian parents is also the good thing, because they are so protective. Some parents may also be equally supportive of you when you approach them, when you talk to them. They can be equally protective, that they can be helpful. Okay, a lot of them are not gonna. The first thing are not, they're not gonna tell you, okay, well, let's go visit a psychiatrist. They'll say, no, you can cope up with it. It'll be all right.
Right.
We'll deal with it. You should be more strong. Okay, so that is a very, very
Positive socho. Positive socho.
exactly. Positive socho is the worst thing that you can tell the patient. See, you need. The thing is, you don't always see. In spite of your parents not approving, you still, if you are an adult, you can still visit a doctor and take a consultation. You can get your parents to the doctor or a counselor and explain them that this is an illness, this is something wrong, this is something that is not ordinary, and that needs to be explained to the parents. What we do is that we explain the parents the biological model of the illness, the whole process of how this is not different than any other disorder. So if you can do that, if you can make your parents talk to a doctor, then it will be better. If not, you still should not hesitate on seeking help just because your parents are preventing you from doing so. Because seeking help is the right of each and every person. Your parents' mentalities are not going to change overnight. Because this is something that they have been facing. You might have parents who have also gone through the same, who might understand that this is going to be this is something that they had gone through too, but they did not have the help they needed at that time. Like, the awareness regarding psychiatry is still lacking in India, is still lacking in the elderly generation. The new generation is more proactive regarding, more vocal about their symptoms, more vocal about what they are feeling. But the previous generation is not so accepting. So either you try and explain them, what is going on with you, or you get a doctor or a counselor to explain what is going on with you. So that is something that you can go into. Alternatively, you should talk to your parents. What you should inculcate, the thing is, what you should do is, you should try and have these conversations with your parents. It is important to talk about mental health with your parents regularly. So what we should do is, we should normalize talking about mental health. See, this is not something to be done when you have an illness and you're going to talk about it. You should talk about it regularly, like you talk about anything, like you talk about news, like you talk about general knowledge.
Absolutely.
So you need to talk about it regularly, as if you're talking about any other topic.
School or your upcoming exams.
Exactly. So mental health should be discussed normally. Unfortunately, there is no solution to this. Like I said, you need to approach a doctor, you need to approach your parents. If your parents still don't agree, you should still seek help. That is what I believe.
Yeah, absolutely. I completely agree with you. And to all our listeners, listen, you're never alone. I mean, even if you are alone, you can always find professional help. So what if your parents are not supportive, or that they don't understand, or you don't have any friends who understand? It is your birthright to save yourself. So please go out there, educate yourself. Everything starts with your own self. So educate yourself and just go out there and get help. Dr. Dhruv, this has been an amazing session and it was so insightful, so informative. Please tell us, all our listeners, how can, if suppose some of them are in your city, how can they book an appointment with you? How can they reach you? You can just tell us your details.
Sure.
If you're
I work in a government hospital. I also have a private OPD, but it is shut due to the pandemic, because I am not able to work there. So the thing is, if you want to consult me, or consult any other psychiatrist, you can meet me at Sion Hospital. Sion Hospital is a pretty famous place, Lokmanya Tilak Hospital, which is a government hospital.
In Bombay.
Yeah, in Bombay. And it is a very famous hospital where you can get treated for free. The treatment is the medications also. What our department has done for the benefit of the patients is that we provide medicines at a lower rate. So patients who cannot afford, patients who cannot, who are not working due to the same, can get the benefit of that also. So I work in Sion Hospital during the daytime. I'm also available on Instagram. You can DM me anytime. I'm available on any platform. Also, you can contact any other psychiatrist. This is not necessarily contacting me, because each psychiatrist is going to help you. Like, the unfortunate thing is there is a lack of psychiatrists all over India. The ratio of a patient to doctor is very low. So the psychiatrists are reaching out proactively. There are a lot of my friends, there are a lot of colleagues who are reaching out proactively. All you need to do is reach out from your side. So I'm available at Sion Hospital, Lokmanya Tilak Hospital, in the mornings, or you can DM me. Any one of you can DM me, and I'll gladly respond to each one of them.
That is great. Thank you so much, Dr. Parmar. It was an amazing session, and I will share this session on my feed also, because I really want people to see mental illness for what it is and not feel ashamed about it. For God's sake, it's not like they've done some crime. It's just like having diabetes or BP. So thank you for helping me in reaching more voices for this cause.
So you already are, you already have been. That is what I really want to appreciate about you, that in spite of being such an actor and a celebrity, you still are actively posting about mental health, which not a lot of psychiatrists, not a lot of actors do. Proactively seek out and take sessions with psychiatrists. Most of them take sessions with psychologists. They talk about therapy. A very few of them talk about the need for medications, and I really thank you for doing so. You deserve a big hand for that.
Thank you, Dr. Dhruv, and I hope that we stay in touch. And I wish you all the very best with all your endeavors.
All the best to you.
I will just tag you. I will tag you on my IGTV so that anybody that wants to reach out for a consultation or prescription, they can reach out to you directly.
Definitely.
Thank you very much.
Thank you so much.